Thank you, everyone. Good evening. Thank you for coming to our family webinar series, March and April, ensuring a quality IEP for your child with deaf blindness, garantizar un IEP de calidad para su hijo con sordoceguera. Today's topic is understanding the IEP assessment process, and es comprendiendo el proceso de evaluación del IEP. Some housekeeping that it's always good to remind everyone. Para interpretarle en español, para interpretación en español, haga clic en el globo blanco en la parte inferior de la pantalla con la etiqueta interpretación. Luego haga clic en Spanish y seleccione mute o original audio. If listening in English, click on the white glove at the bottom of the screen, labeled Interpretation. Then click on English and select Mute Original Audio. This webinar will be recorded and archived in our website. The presentation will be approximately 60 minutes and followed by 15 minutes for questions and discussions. Questions and comments can be posted at the chat and will be responded after the presentation. If called upon during the question and answer discussion, find the microphone icon on your Zoom toolbar and click unmute. A link to any handouts will be posted in the chat. And here's some Zoom tips that you can follow. You have the unmute button only when it is your turn to speak. The stop the video during the presentation. Chat for comments and questions, raise hand when you are requesting to speak, and there's one more that is leave the meeting once the meeting finished. So I'm gonna just stop sharing. And again, welcome everyone. And like I said, today's webinar is understanding the IEP process. And I'm so happy to introduce Darlene Norman, who's going to be our presenter tonight. Darlene Norman is a parent of an 11-year-old daughter with Chart syndrome. Darlene's introduction to serving people with disabilities began in college when she earned her master's degree in school psychology. Darlene has worked in public schools as an advocate, school psychologist, program specialist, and director of special education, spanning birth to 22 programming for over 16 years. Darlene serves as a parent liaison for deafblind needs with local, state, and national parent advocacy organizations. Her knowledge and experience with psychoeducational assessment, IEP development and implementation, multidisciplinary medical teams, and community development disability systems have helped her to develop methods to keep her organization and advocacy on track. Darlene is the founder and CEO of Embrace IDEA and serves as a parent coach and mentor to implement customized organizational systems and digital personal passports that works for their needs. Darlene is also an independent facilitator supporting families in their advocacy and self-determination program, transition in developing personal center plans. Would you like to add anything else, Darlene? This is a wonderful.
That's funny.
Yes.
I'm starting to feel older. Very better.
Not at all. So I'll just pass the floor to you. Thank you again for agreeing to talk about this very, very informational topic.
Well, thank you to California Deafblind Services for having me. I'm so happy to be one of our parents in our FSP group, but also to have this organization as a wonderful resource. It's certainly connected us to other families and other resources, and I know for sure our daughter would not be anywhere near where she is without the resources from the deafblind community. So thank you again for having me. So we're here to talk about IEP assessments and answer any questions that you might have. It was really helpful to have the parent feedback from the IEP Cafe that CDBS gathered some input, and those types of questions were incorporated into the presentation. But if you come up with any other questions, I'm more than happy to address them as a result of this presentation today. And so we're going to start by just talking a little bit about what assessments look like and who's involved in both the assessment process and the team. Children who are deafblind often have a large multidisciplinary team that's going to be involved. And then talking along the assessment process, we always need to get parent input and permission as part of that process. Now, I will say IDEA laws is a federal law, and it's applied differently across states. I did happen to see that NFADB did a post about this, so we may have some families who are watching this that are not from California. So I will talk a little bit about state differences, and if a parent or participant is watching from another state, different education laws apply in different states. So just be aware of that. We'll talk about the RIOT ISIL matrix. It is an acronym, and special education is full of them. So that way you have an understanding as to what schools can and should do when they're making considerations for doing the whole IEP or assessment process. Parent participation is a really huge component. This often is an item that you have to check as part of an IEP document. Did you get a chance to meaningfully participate? Do you feel like you got to meaningfully participate? And your input in the whole process itself. Oftentimes as parents, we might feel like things are left to the professionals, but there are many ways that you can seek from an advocacy perspective how to participate and ask questions. We'll talk about accessibility considerations for deafblind youth, also the validity of assessments. And so essentially when we are going through the assessment process, is the information that is being gathered and reported on valid and reliable information? Because you're using this information to make big decisions with regards to supporting a student with deafblindness. There's lots of different assessment tools out there, and there's different types of testing tools themselves. So we'll talk about norm referenced and criterion reference testing and do some explanation with those. We also want to have an understanding as to what should go into an evaluation report, the considerations and eligibility criteria and categories that teams are making decisions on. It is important, especially for this population, to be correctly identified, as there are multiple resources that can be available with identifying correct categories. And as with any IEP, we are going to make sure we are identifying areas of need, which will then help drive what goals will be discussed and written. And then, because those will lead directly to services and program placements and supports. And then there is another topic that will be presented on, I think, next week about specifically accommodations and modifications. So I just have a quick little slide or two on this topic itself, just to give a little preview. And there was a question that came up in the IEP Cafe about what happens if I do not agree with the assessment results? What rights do I have? What are the options? And so we will talk about independent educational evaluations as they are a part of your parent rights. All right, so one of the things we want to do is we want to help our participants just know what are the things that we want to learn today. So in addition to the agenda topics, we just want to make sure people know that what considerations are needed for students with deafblindness. It is a very specialized population, and it's a low incidence population, which means there aren't as many professionals out there who will seek to learn and know about the topic itself and how to support students with these different needs. And so there may be resources that are outside of the district that might need to be sought after. Okay, we'll also inform parents as to who needs to be on that assessment team, the appropriate tools. Getting to learn the names of them and being able to ask questions will be helpful. And then, as mentioned before, the eligibility categories. Okay, so what I have here is cited is the federal law, IDEA. And so for any state, they will have their own state regulations or state laws. In California, it happens to be California Education Code. There's not, there are a few references scattered throughout this presentation for California, but essentially there's federal legislation that's occurring through Congress that are directly going to be impacting special education and students with deafblindness. So I think it's important for families to just be aware of the federal law, but also in the state of California, there are a lot more protections for parents and parental rights here than there are in other states. So you may or may not be aware of that with regards to California, but parental rights is a really big thing that we have here. So when you are asked to review information or sign for consent for something, it really needs to be done with care and informed consent. Okay, so there's a few different areas or documents that you can gather those types of information so that way you understand what what you're reviewing and what you're being asked to sign off on. So when you get a copy of this presentation here, there are going to be links that are embedded within the document. I will also just create a Google Doc. This is for CDBS that will have the links separately just in case it's easier in a live Google Doc. So that way it's more accessible. But essentially on this slide here, there's the first link is the California Notice of Procedural Safeguards. The most recent copy is revised from June 2022. And the thing to know about this is that there are certain aspects within this document that are specific to individuals who are deaf, hard of hearing, or blind, visually impaired, and as an inclusive topic, deafblind. So it is very important. It is something that can often get missed. It is a procedural violation if an IEP team does not offer the procedural safeguards to you in IEP meetings. There's at least an annual requirement to help ensure that families receive it. And anytime that there's a revised copy, you absolutely want to get your hands on it and understand and learn what changes might have occurred. Oftentimes more rights are being given or clarifications are being written into these types of documents. So again, just really knowing what's in there is important. Organizations such as CDBS or your family resource centers or your parent training information centers. One of the big ones in Northern California is called Parents Helping Parents. So these are just local state resources that are available to support families with understanding resources and rights. Okay. And another link that I have in here is from the California Department of Education. It's also the procedural safeguards in English and just a link to their website as well. So what I've done is highlighted throughout. One second. There we go. What I've done is kind of highlighted throughout just keywords with regards to the legislation. And these are things that we'll be reviewing as part of the presentation. Okay, so on this slide here, using a variety of assessment tools and strategies is important. The evaluation is really used to determine whether or not a child is both eligible for special education, that they're a child with a disability, and that we're also looking to evaluate what their present levels are. Because this information will be put into the content of the child's IEP itself. And there's two terms for evaluations that you're going to encounter. So if your child is in early start, it's often it's a similar yet different process, but these IDEA regulations are really related to school-aged children, so students who are moving into the 3-year-old to 22-year-old phase. And that they're really working with school districts for the eligibility criteria once they turn 3 and up, because it is different for early start. And that initial evaluation is that first step where you're identifying eligibility categories and starting the stage for your introduction into IEPs. IEP documents do change over time just with new legislation, but they also will change as the student ages up. Different requirements pop up into what goes into an IEP, particularly when they're in high school. The transition planning is an important part of what goes into the evaluation process and planning for long-term future after the individual is exited from special education. So other items on this slide is that to ensure that there's not one piece of information or one singular notion that's being used to make determinations about certain things on the IEPs, that you're using multiple modes of information, multiple modes of opportunities to gather what that data looks like. You're also wanting to make sure that there's sound instruments that are available for a population who's being evaluated under the deaf-blind category. This is a very unique approach. There are very few assessment tools that are appropriate for the deaf-blind population from a standardized perspective, but there are also tools that are very appropriate because of the way that they're designed to help meet and measure uh, growth and progress. Okay, so other pieces under legislation is that there's a variety of assessment tools that can be selected, and these are all going to be encompassed under the different categories of the development that are being evaluated for. And so there's different selections of tools that we'll cover, and I'll talk about examples, and I'm more than happy to answer questions about specific ones. The things here is that items that are being used really need to not be discriminatory, and this is where the sensory disability needs for deaf-blind are important to factor in. The nature of standardized or traditional testing tools is that they can be discriminatory just based off of the sole fact that they're not represented in the population that the tests were built upon or developed on, using individuals with deafblindness in their norming population. So it is pretty reflective of testing data that standardized assessment numbers will be a lot lower than the normative population. So or people without disabilities. We're also making considerations for language. So oftentimes we're working with multiple languages, and what's unique to the child themselves and the family. The child might be born into a monolingual family, such as English only, or Spanish only, or if this individual is born into in a non-English speaking family, but they are considered deaf, and they are learning ASL as another mode of communication, but they're also attending an English-speaking school. There's multiple communication needs that need to be really considered with regards to all the different factors that go into access to language. And we'll talk about that a little bit better coming up. So I mentioned here that reliability and validity are really important. If the data that's being collected is not to be trusted, then how can we make decisions based upon it? So it really is about the presentation of information and the individual students themselves. There will be a lot of numbers that will get placed into an evaluation report, but it's often not the numbers that tell the story about the student. It really should be about the descriptions, the detailed explanations as to what the child is able to do and perform. And then this other piece here is whether or not the assessment tools are are administered by trained and knowledgeable personnel. So this is a really big factor when it comes to communication and modes of communication, and whether or not the evaluation team is able to communicate directly with another member of the family that's not speaking the same language. The majority of personnel in schools are English speakers, and so that is often the primary language that multidisciplinary team members will have as part of their team. And so if you do not have another team member who can speak the language of the family or may or not be ASL proficient, and that's a need for the communication modes for the family, then interpretation skills will need to be brought in. But in addition, oftentimes there might be some training and resources that evaluation teams can seek as they're preparing for these evaluations to be able to help with that guidance. I think in reality, most teams are willing to learn and to support the students with making sure that they're ensuring a solid evaluation, and that's meaningful. And so, but there are resources that that can and should be accessed to help evaluation team members just do an appropriate evaluation to help serve the needs of the families. And we also want to make sure that things are done with us in a standardized manner, the instructions. And we'll talk about different procedures with relation to that, because there are many ways that we can gather useful information that are not standardized. Okay, so some of this is very similar to what I've spoken before. It's just reiterated in a few different ways, but essentially we want to make sure that all the assessment tools that are being used are meaningful and that they will help to ensure that we are addressing the sensory loss needs for the individuals that we're working with. And the other thing is what we're also making sure we're evaluating in all areas related to the suspected disability. So there's a list here of what that might encompass, and you'll see these things on an assessment plan, which I do have a sample that will be on an upcoming slide. Okay, so and that when you are finishing the evaluation process, that it was meaningfully designed and comprehensive in nature, so that way all the areas of special education services that the student qualifies for and needs are available, and that the data is gathered has been sufficient and will help to the teams to determine what is needed to fully write that IEP. All right, so here's a quick visual with relation to the process itself. You'll see that there's two pathways here. The first one is the assessment process. So it's essentially the first step. So parents will be presented with an assessment plan, and this is essentially your notice that you're receiving that your child is being evaluated, and consent is often necessary but not always required. And I'll explain. You always have to provide parent consent when you're doing an initial evaluation, and school districts are not able to proceed without getting that initial parent consent. The rules are similar when it's a triennial evaluation, and that parent consent should be sought and hopefully received. But it is possible that it can be challenging to get consent, and so schools have to give notice about the triennial evaluation process and how they're going to proceed with it. There are a few different ways to go about it, including a records review, but a full assessment is often necessary, especially with how our students' needs can change over time, and in incremental ways, but also big ways. And so a school district, if they have a hard time seeking consent to do the evaluation, they do have a responsibility to notify the parents, and with multiple attempts to try to get that. And again, state regulations need to be consulted, because some districts don't need to have that, or sorry, some states don't have to get full consent. As long as they give that prior written notice letter, they have the right to proceed, because they have an obligation to do that per the laws related to evaluation. So on the assessment plan, which we'll address on the next slide, there are multiple ways to gather information, including a records review. You'll notice here that I've underlined the first initial for each word, and this is part of that RIOT ISIL acronym that I had mentioned at the beginning. So first is a records review. This is an easy way to get at least a beginning understanding of the individual and what their history entails. Having information about what's already occurred or what is in place will help drive what the next steps are. And many components of an assessment process don't have to be done with the student present. They can be done and are done without the student present, because you can gather lots of information without without having to work directly with the student. So in addition to records review, interviews, this can be done and should be done with parents and with any team member that's relevant. So any learning environment that the student is in, any service provider, if the student has outside providers that they're working with, either medical professionals or private service delivery providers, being able to seek information from them will be helpful as well. The individual might perform differently in other settings, perhaps better, perhaps worse. Gathering that data will be important. And the standardized testing process isn't always reflective of everything the individual can do because of the contrived nature of testing. So interviews as well as observations are really good ways to gather information about individuals who are deafblind. And observations can and should be done in a variety of settings. So that way you can see how the individual does with one location versus another, and or one provider versus another, because that can mean a difference too. Some students will do better with others, and so being able to learn from each other what works best will be helpful for understanding how do you come together and work together so that way you're getting the best out of the student when they're at school. Okay, so testing is the last piece. It is not necessarily required to have to do the formalized testing, the standardized testing, which I'll talk more about. It is available and it can be done under many circumstances. But like I mentioned, standardized testing tools have a bias against individuals who have sensory loss needs. And the majority of the times, individuals performance, their scores are going to be, they're going to fall below areas of development that compared to other peers of the same age, just by the nature of the disability law, the sensory loss needs and whatnot. And there are very few tools that are designed for the deafblind population. So I still think and believe that testing is important. You can get a lot of observational data from it. And from when you present a task and how it's administered. And so there's still importance to testing, but perhaps not the end result of the numbers themselves. And so under the next line here, this demonstrates that there's multiple ways, multiple factors to access information about the student's learning. So you want to consider what's the instructional mode, what are the ways that the student is being instructed on, what's the location. Oftentimes environment is going to be a location of where the student is learning, curriculum, what kind of access to learning areas are available to the student, and not just academic. This can be in other areas as well, such as adaptive skills or communication, motor, things like that. And then you always want to factor in the learner as well. So there is a table that can be used. And I have a few resource links in the slide towards the end that will take you to a few different Riot ISIL matrices examples that you can look into and use. And more than likely, I would hope that your assessment teams have familiarity with these. These are things that are taught in graduate school programs for school psychologists. And so this is a method to be able to gather information. And again, you don't have to do it in every cell, but being able to understand as to can you gather as meaningful information in many of these different areas without having to do direct testing, just by the sheer bias of the way testing can work. Okay, so this is actually one of my favorite slides because it kind of tells our stories as families of who all we have to navigate working with over the course of our child's educational career. It can also be reflective as to the developmental disability services teams, the medical teams that we have to navigate as well. And so it can be a large number of individuals. And so these evaluation team members may pop in and out of your students' careers at different points. So for example, an early childhood education specialist is really going to be focused on that birth to 3 or preschool age population, or perhaps even towards kindergarten. But once you reach kindergarten up, you're often working with special education teachers or specialists that are focused on those age ranges. And then when you get to the older ages, by 16 and above, you're oftentimes younger with our students, is transition specialists as well. But we have a variety of team members that we work with to cover motor, OT, PT, adaptive PE, orthopedic impairment, and such. And so covering the deaf blind spectrum, you'll have teachers of the visually impaired, orientation mobility teachers, deaf hard of hearing teachers, educational audiologists, interpreters, interveners, translators, speech and language pathologists. And so there's many more on the list to mention, but this number of people could be a part of your child's evaluation team, and that's a lot. It can be a lot of people that is having to work with your child. And so that's also why the RIO, records review, interviews, and observations, is a way to use the assessment process without overwhelming the student with putting too many demands when they may not be needed. So this here is a copy of a sample assessment plan. It is absolutely blank. This is pulled from one of the California state systems that get used to write IEPs. And you'll see there's a prior written notice letter on the left, and on the right side, it lists the identifying areas of evaluation that will be completed. And so depending on the student's age, but most of the time, many of these boxes are going to be checked, including academic achievement, which can be completed by a special education teacher, a deaf hard of hearing teacher, a school psychologist, an early childhood specialist, or just a few examiners that might fall under that category. Health is being reviewed by a health specialist, such as a nurse. And a school psychologist might review health information as well as part of the records review. Cognitive or intellectual development is another area. Language, speech, communication, perceptual motor, social emotional, adaptive behavior. And then for those older students, post-secondary transition. Other is going to be another category. It's kind of that, like, what else can fit in this area? So this could be really useful for either behavioral needs or the teacher of the visually impaired, orientation mobility specialist, those that are doing the functional vision assessments, learning media assessments, and identifying these. And then there's also alternate means of assessment. So there might be multiple ways that we're gathering that information. And so oftentimes most of these boxes are going to be checked off for the deafblind population. And my daughter actually just went through a triennial process. And what I did with them is I actually gathered them for an IEP meeting prior to her evaluation coming due, to be able, and what we did is we wrote this all together. This was screen shared on, we often do meetings on Zoom since there's so many of us. And we just went through each area and checked the boxes and had a conversation about what to expect as part of the assessment. And so that might be something to help you through the process, that you might request something like that as well. So that way you're prepared for the evaluation and can hopefully proceed in a multidisciplinary format where you're all on the same page. And as always, there's always consent boxes and signatures for you to review and sign off on. And always that checkbox of I have received a copy of my procedural safeguards. That's on many, many documents. Okay, so for parent participation input, so in the state of California, the school district has 15 days to respond to the request for an evaluation. So that's often in an initial evaluation. And so many of our deafblind students are coming through the Early Start program because of early identification. However, there are many individuals who are on the deafblind continuum that don't get identified till later. So that's also a possibility too. But in California, the districts have 15 days to respond to a request to an evaluation where they need to present you with that assessment plan. And when you're managing a triennial evaluation, as I mentioned, it's helpful to have a planning meeting before the triennial is due to occur. And so I generally suggest about 90 days before that triennial is due. Because with an assessment plan, once you sign consent, this district has 60 days to complete the whole evaluation process. And that timeline can mean a few different things depending on where you are in the year. And so there's ways to go about that. But essentially, they have 60 calendar days, unless there's a school break like winter break or summer break that's somewhere in the realm, to complete the evaluation. And it is based upon that school district's calendar, on when timelines might get paused, to allow for longer breaks like a winter break. You do want to review the assessment plan for accuracy, because if you feel like something's not captured, and this is important, I spent a lot of time on those initial slides as to what needs to be evaluated for, and this is important for parents to review and know that if you don't believe a full team has been offered, a full evaluation is being offered to you in the assessment plan, this is your time to ask for additional things to be included and say, I have concerns about X, and identify what those might be. And then once you get that assessment plan, and you're comfortable with it, go ahead and sign it. If you decide or you realize you forgot something, it's okay to let them know and say, hey, I would like this area evaluated too. They can present you with an updated assessment plan to sign consent for that, or get your permission in writing to include a new area or a new team member. So when we're looking at the records review section, it's really helpful and important for families to provide as much information as possible. And oftentimes we have a lot of records that are available for review. There could be updated ophthalmology information, audiology information, health records that are impactful to the student's learning. Are there private services that are being delivered, or regional center services that are part of what the student has available, and are they making and adding to the meaningful progress that the student is making at school? So this is a way for you to be able to say, hey, I have this information. I'd like for you to review and consider it and include it in your evaluation. Sometimes there are new diagnoses that pop up too, which might mean that new team members might need to come onto the evaluation team. It's always important to give as much information as possible, so that way everything can be reviewed and incorporated in the process. Another way parents can participate is in the interviews. If it's by chance not offered by the evaluation team for you to be interviewed, you can request to be interviewed, especially to give your feedback. Many times you're being asked to complete forms with updated developmental or health information, rating scales, health information, and it can be overwhelming. There's a lot of information to provide in the assessment process. So if you feel more comfortable to do that in an interview format with a team member, you should tell them, say, I prefer to have this be done through an interview. Or if there's an interpreter that's needed, an interview might be a better way for the provider to gather your parent input. So that way it's being translated in real time to be able to capture what information is needed. Under the observation and testing, what we do here is I know this came up in the IEP Cafe questions, is whether or not parents have rights to participate in different kinds of observations. So your input will definitely be important when you're considering what times of days and activities are being used to select for school observations. So if you're familiar or you have input as to, the morning time is it's a really hard time for my child. They're not a morning person. So it's really important to capture, when they have a difficult time, or when they have a time of day that's also really impactful for when they do their best learning. And as family members, you can gauge as to what time of day that might be. That teacher of the program or the school is also going to be an important factor to ask what their feedback is. And ideally, the school psychologists and in any other school providers, they're doing observations in a variety of settings, and that can be included in the evaluation report. When it comes to parent observations of their own child, you do have the right to request for observations. You can also make observations for any placements that are being reviewed and considered by the IEP team. And that's part of your methods to be able to say, yes, I have meaningfully participated in my child's IEP process. So if you ever have questions or concerns and aren't sure what programs or schools look like, it would be important for you to have an opportunity to take a peek. Um, with regards to testing, there's I personally have done evaluations in both ways where parents are not involved or participatory in the evaluation process, and where some are heavily involved. When you're talking about early childhood, particularly like preschool, or the early start to preschool transition, parents are really involved because they are the primary teacher for their students. As parents, they're with their children the most of the time, and so they're often their child's first teacher. And so they likely are going to participate in the evaluation process because of their age. But as the individual grows older, has more skills, is in more traditional school-like settings, it's less likely for the parents to be heavily involved in those processes. And the thing with practitioners and whether or not they get a request from a parent to participate or be in the room can be based off of a few factors. If there's health needs that the parents help support, and so they're there to help with that process versus like another health provider or a nurse, or if a parent is curious about cognitive testing, you might get a few different responses based off of the situation. So you might be welcomed and say, you're welcome to sit in the room. I'm going to create a partition for you to sit behind, so you can listen in. But we do have a responsibility as assessors to protect the copyrighted uh, tests themselves. So in general, um, uh, people who are not being evaluated should not be given access to the copyrighted testing materials by the sheer nature of how testing works. We want to administer a standardized test in a way that is originally designed to, so that way that type of information can be gathered. But there's other ways of getting standardized information too, including testing the limits, giving extended time, or asking additional questions, modifying how we present the information or ask the questions based off of the individual's communication needs, things like that. So sometimes parents might participate in helping that process, and sometimes they aren't. But you will get varying answers based off of your individual child's needs, and then also I think sometimes the resources of what's available for the individual. So for deaf-blind assessments, accessibility is always a factor that has to be carefully considered, just by the dual nature of hearing loss and vision loss. And because there's a spectrum for both the vision loss needs and the hearing loss needs, many different components, many combinations of these types of things will be considered, and they're very unique and individualized to the student. So whether or not they have hearing devices, hearing aids, cochlear implants, BAHAs, unilateral, bilateral, are there FM systems that are being used? Are they needed for the assessment? What is the student's language access or modes of communication? Are they fluent with sign language? Are they still learning? Do they need both oral and sign versus one versus the other? In regards to sign language, are they working on having access to C sign or ASL, or perhaps tactile or protactile sign language? So all these different things are really going to factor into how do we present information to the student who's being assessed, and how do we gather it back from the student. So on the continuum of vision loss, they will have different devices. So whether or not they wear glasses or not is going to be a factor. Sometimes students might have ears that don't allow for glasses to sit well. And so they might have different ways to be able to make the glasses work best for the student. And sometimes glasses just aren't a factor because of the way they might sit on the individual's face. And the vision loss can also be unilateral or bilateral, and there's so many components to the eyes, not just the eye structure itself, but also brain-based vision loss is also a factor to consider. So there are many presentations that can go into just these two topics about deaf, hard of hearing and vision loss topics themselves. There are multiple resources that I'll provide as well in that Google Doc that I mentioned, because there's There's a lot of information out there for practitioners to implement, and then for parents to just start to understand as well. But ideally, you're relying on your team for that valuable information, and you're asking them questions that you have concerns about, or you just want to know information, and that they're either able to provide it to you because they know this information, or they're willing to seek it out, so that way you feel confident in their skills to do the evaluation. Okay, and then the other factor related to vision loss is that functional vision assessment and learning media. What does the student use as part of their learning modes? So whether they have vision access for large print, or they might need Braille. Okay, so these next two slides are written first. So when that large assessment team that's part of your child it's a lot of people, and so you want them to be coordinated. You want assessments to be done in the correct order. So one of the first people who should be doing their assessments is the teacher of the visually impaired, or orientation mobility specialist, depending on, sometimes they're dually credentialed to do both, serve in both roles. But you want that individual, that team member, to be able to do the assessment first, because it is going to drive what the team might use for access needs when they're doing the evaluation. So this slide talks all about functional vision assessments. What is it? It's really a determination as to how well your child uses their vision when they're doing different tasks, and also the different locations that they might be working in. So whether it's home as part of their home-based instruction, if that's where they're at, or if they're in the school setting, it could be one classroom, it could be many settings, depending on if your child travels. Who does the evaluation? It's that specialist with the area of visual impairment. Children with visual impairments and those dual sensory loss needs really need to have a functional vision assessment done. And that there also is information available from the ophthalmologist, because sometimes the cause of the vision loss is going to play a role into how the functional vision assessment results might be. And you're going to have the FVA is conducted by using lots of observational skills. It could also be gathered from information that other people are reporting to the TVI. You're going to factor in, what does the learning environment look like? And learning can occur both in the classroom setting, in the cafeteria, on the playground, on the bus, anywhere that the child is learning. And as I mentioned, lots of information is already available, so that TVI can review records and do interviews to gather that information. And then after that, the learning media assessment is going to be helpful with regards to factoring what is their mode for learning, especially literacy, and learning how to understand language and to read and access language, whether it be Braille, print, audio, listening, and for those individuals who are learning by use of objects or visuals, pictures. Okay, it's the same thing where the teacher of the visual impairment is going to do that assessment. And it's them gathering information. How do they use all their multiple senses to learn in their environments? And this, there's a particular order, like I said, when it should be done. It needs to be after the FVA is completed and before other assessments. And then this report needs to be shared out with the evaluation team, so that way they're familiar with it as well, because it will help drive what tools are selected. And so learning media assessment results can evolve over time, for young children, because literacy is often, they're learning letters or having access to learning letters at young ages, but those skills might not really fully develop until they're in their school age years. So having this repeated over the course of their educational career, you're really going to see some differences over time. And then there's distinctions between whether or not a student might need print or Braille, large print in particular. It's less common from a percentage standpoint. There are a few individuals with vision loss that are using Braille compared to large print. And there's a lot of accessibility needs in relation to that. But both needs to be considered, and with how the access to tools will be. because there's a variety of learning materials, books, textbooks, novels, equipment, Braille transcribers that might need to do a lot of work to be able to make the students' curriculum and content accessible to them, either through the assessment process or planning for the future when you're planning out the IEP and what goals and services are being addressed with access to things like Braille. And we're also making considerations for hearing loss because of that combined nature, and that it is anticipated that there's going to be that multiplier effect of what both vision and hearing loss will have on a student. Okay, so the validity of assessments here, I've mentioned before, but I'll just to reiterate, assessments, standardized assessments are really going to produce often results or numbers that are lower than the normative population, so people without disabilities. And so what needs to happen is when a standardized assessment tool is being delivered, the standardized procedures that are used and any departures from them need to be identified. They are going to need to talk about how did I present this information and gather it, so that way when they talk about the results, they can say this is a valid reflection of the student's skills under these testing circumstances. Okay, I'm going to go through these slides really quickly because there's a lot of information to gather from it, but there are resources related from the American Printing House for the Blind about intelligence testing for individuals who are blind or visually impaired. It's information that is that can also be applied to not just cognitive testing, but speech and language testing, to motor testing and things like that. So you always want to consider what are the resources out there available, so that way you learn about what kinds of things are needed in order to have a solid assessment. And there's lots of rules to follow with regards to accessibility. So the first slide is regards to the blind visually impaired. And then the National Association of School Psychologists also has a position statement for the deaf, hard of hearing population. And there's lots that go into assessments for deaf, hard of hearing, including like the considerations for culture and language needs, because there's such a large variety. Okay, and then the deaf, hard of hearing slide has another slide here because of how role it is, or how big the role can be with deaf, hard of hearing individuals. And I want to comment here the role of the deaf, hard of hearing specialists, but also school psychologists and how they factor in. There are state schools for the deaf and blind in California and across the nation, although not every state has one. So these two schools, these centers, are really valuable for school teams to reach out and ask questions. They often have resource teams available to address questions in relation to testing this population. The California School for the Blind has an assessment clinic where you can get referred to for free testing. It is through the school district or the IEP team that's making those referrals, but they're an excellent resource if vision needs are really a factor for those learning environments. Okay, so here's another slide. It has a lot of words on it. I apologize, but the information, the text is really important for, particularly if you want to share this information with your students' teams when they are beginning the assessment process. And there's a whole continuum of placements for students, from the least restrictive environment, often being considered as the homeschool or general education, to more restrictive environments such as special day classes or separate settings, state schools, the School for the Blind, School for the Deaf. Those should be considered as placement options when needed and the family is interested in. Okay, so there's a couple of assessment tools here that I'm going to outline: norm reference tools and criterion reference tools. Essentially, just knowing that the norm reference tools on the left side here, these are the ones that have a lot of strict rules in relation to administration of the tests. And I outline here, these are acronyms, but you can Google these to find more information about them. They often have multiple editions, so you always want to look for the newest edition So the C-TONY is a nonverbal assessment. This might be useful for individuals who have low hearing accessibility, but might have accessible vision to administer these. And some tests come in large print or braille, such as the Woodcock-Johnson cognitive test and academic test. The RAT is WRAT, comes in a large print in braille version. And with the norm referenced assessments, these are comparing students against the normative population, which means a whole continuum of individuals who have disabilities and those who don't. And you'll learn about the bell curve and percentages and percentile ranks, standard scores, scale scores, and these are data that will go into the evaluation report, and those are considered norm reference tools because that individual student is being compared to this broader population, and the child is being compared to other children their same age, so that will give you that information. They wouldn't be considered or be compared to other individuals of different ages because wouldn't necessarily be appropriate for that type of tool. However, on the criterion reference, it doesn't matter the student's age oftentimes, and that it's really about the skill set. What is the skill set that is this or the skill that the student is being asked to perform, or that the evaluator is gathering information on from parent observations and interviews, teacher interviews, their own observations of the student, and they're just using it to check off, does this student demonstrate this skill? And what are the next steps in the continuum of skills that the student can work towards? And that can be used to develop IEP goals as well. Okay, so the goal here is on the criterion reference is that it's really about skill sets that the individual is learning and being measured against versus age related or norm referenced tools. And so these are a few tools here: the Brigance, the Oregon Project, and the Insight Checklist are common ones. Some of them are limited in age, but your assessment team is going to be able to help you with gathering that. I'm going to go quickly through towards the end because we're coming to the point where there's questions, and I apologize. I spent a lot of time on the beginning, but there's strengths and challenges for both norm reference and criterion reference tools here that I will just screen share and have in the presentation. The things to make note of is the documentation that your evaluation teams have are really important to have all the information that's needed. A standard assessment template report that your evaluation team uses may not be sufficient. There needs to be additional language written into the report about the low incidence nature of the disability, how that impacted testing, deaf culture, language access is a really important part. And all those are going to be put into the results and present levels of performance, writing summaries of what that student can do for these different areas. And then the recommendations are going to be used from that to develop the IEP. And so eligibility is a really big thing here. I want to encourage parents, especially you're here for a deafblind assessment topic, and you will want to encourage your IEP team to identify that deafblind factor when you're sitting at the table for the IEP, because of the census count that each state has to do. It pulls in resources to the California Deafblind Services state projects to be able to bring in the resources to the state because of the representation numbers. And school psychologists, teachers of the deaf, teachers of the visually impaired, all these people that sit on an IEP team are going to be knowledgeable about many of these categories that are listed here, but they're often not going to be fully versed in deafblindness. And so being able to share that, like, this is a really important category to identify. It is a low incidence disability. It brings in access to specialized money to be able to buy tools for the particular need related to deafblindness. But you can also make considerations for all these other categories. Oftentimes, students who are deafblind can meet multiple eligibility categories. You only need one, but you can have a couple identified either formally on the IEP or in the notes, whatever is most appropriate. But I do want to encourage teams to really have that identification for deafblindness on here, even if there's other categories that are listed. Okay, so as mentioned on the assessment plan, these are all the areas of assessment that are can be evaluated for. You might have goals in all of these different areas. And so I do want to encourage parents and IEP teams to be really intentional about the IEP goals that are identified. Students who are deafblind can have a lot of different areas of need. And so, and what people might think is that we need to write so many goals in each area because we want to monitor these things. And it's important to monitor all the areas of need, but you also want to be intentional about the goals that are being developed, because ideally they are they're long-term goals over the year, and there's many skills that can be incorporated within a goal itself, even if it's not explicitly identified. And having really good conversations about that with the professionals, the providers, as to what that looks like. But if you don't feel as though good instruction is occurring, then and you want something more specific and you need multiple goals in certain areas, you can ask for that. You should ask for that. I've personally asked for that for my own daughter's team when I I I had strong suspicions and knowledge that particular areas of need were not being addressed. And so being able to write goals for what's necessary is important. But just know there's so many different areas for children who are deafblind that it can be overwhelming for teams to be able to manage. So again, there's a long list for all of the different areas for areas of need, goals, continuum of services. The IEP document itself will be fairly lengthy when it gets finalized, and there's lots of services that can be developed based off of it. Okay, but that evaluation at the core of it is really important because that's often driving the eligibility for services and then helping the team make determinations about what needs. So there are accommodations and modifications here. I'll leave that for the next team to present on in a following presentation. But to wrap it up, the last piece is the independent educational evaluation. So if you feel that your child's needs were not fully answered in the evaluation process, that you have more questions, or it wasn't representative of your child's needs, it might have met the eligibility factor for qualifying for an IEP, but perhaps your child wasn't fully described and you feel like you need an independent education evaluation, you can have one. You just ask for it. There's a process for it. You can disagree with the assessment results. Oftentimes you don't even have to tell them what you disagree with. You just can request and put it in writing that you want an evaluation, an IEE conducted. And you can it's important to identify what areas you want evaluated. If you didn't agree with the speech and language evaluation and you want a speech and language IEE, ask for it. Or if you felt like the academic portion wasn't done well, ask for that. You can ask for all or pieces of it. You might have appreciated most of the evaluation, but if one particular area wasn't fully evaluated for, then go ahead and ask for that specific thing to be addressed. There is oftentimes a time component. You want to ask for that within the first year or two before the next triennial is due 3 years later in order for it to really be impactful. But there's a process, and just always ask and answer your questions. So there's a slide here with how to go through that process, and districts have a responsibility to either one, fund it, or B, their alternate option is to file for due process. And most of the time they don't want to file for due process. It's too lengthy, it's costly, it's exhausting. And so funding an IE is often the most appropriate response because it helps to answer and address the family's questions. Okay. And then the last slides have a lot of different resources on it. I went overboard probably, but there's lots of different resources here available with direct links that you can click on within this. And again, I will put this in a Google Doc so it can be easily shared and accessible for understanding your rights as parents of the deafblind population. Okay. And that should be it. Okay. There's probably about 9-10 minutes left for questions, so I apologize that my topic was a little lengthy. And so I'm gonna dig through the chat here to see what questions came up. So it says, when a parent asks for an IEE, who chooses the evaluator? Great question. Parents get to select who the evaluator is. You may not know who conducts evaluations that can serve the deafblind population. And so you want to ask the district for who meets the criteria to do that evaluation. So for example, communication. If you're looking for a speech and language pathologist to do an evaluation, you can ask for what's the criteria for them to be approved, and is there an approved list of evaluators already that the district has, or in California, if the SELPA has one, or you can find one through parent resources, information groups and things like that. Or a good old Google search will often do the trick too. And you want to interview those people because you want to make sure, or another local district to be able to really furnish that child's team and have everybody at the table. And so they can't just say no. They might say no, but you should ask for the why, and then also present, here's the need. And so, and if they say no, you say, I'm going to ask for an evaluation. I want you to do an evaluation as to why or why not my child